I would like to introduce our next speaker today, Dr. JaredSkowron. He is going to be talking about mitochondrial dysfunction in autism. Welcome. Thank you for being here.
No, thanks, Kristen. It's a pleasure.
Well, I've known you for years, and, I know many families. You've helped many and many, many families throughout the country and the world, But for those that might not have heard about you yet, can you maybe talk about why you are so passionate about what you do?
Yeah, I'd love to. I've been a biomedical physician for almost 15 years now. And, when I started practicing, autism was 1 in 200, 1 in 150 people, 150 kids. And, I was able to help make changes. And the first girl I saw was wheelchair bound, and she didn't know the difference between me and the wall. And I didn't know very much about autism, but I knew about nutrition for the brain. And we started feeding her B vitamins and magnesium and fish oils and some of the basics that we know today. But again, rewind the clock 15 years and we were still learning things. And, within a month of treating her, she would make eye contact with me. And within another month, she started talking. And then she started going to school. And then she's moving around. And when I was just starting my practice, I was so happy to do something when I knew practically nothing. I said to myself, what if I knew something? And so, the past years and years and years have been learning and learning and learning with every child and every family and every research study that comes out, that it's just become my passion. And it's the way that I discovered my purpose to help kids and help families. And now we've grown our biomedical center, and I practice in Connecticut. We built it to one of the largest ones in New England. And so it really makes me happy to help these kids.
Well, you told me before we started talking about your practice a little bit. I'm really in awe. You want to go over a little bit what you guys are now having at your practice?
Yeah, so we've expanded to 5 physicians, and we've got a medical assistant who runs our hyperbaric oxygen chamber. So we've got hyperbaric. I personally have always focused on brain chemistry, and we see so many symptomatic improvements in behavior and language when we analyze brain chemistry and bring about the nutrition to balance that. And that involves genetics, and of course that's what we're going to talk about today, is some genetic stuff that's been new for us. The genetics of brain chemistry, the nutrition behind brain chemistry. Obviously we have a nutritionist, we have a new doc who's been an ABA therapist for 10 years. We have neurofeedback, we have biofeedback, we have craniosacral, we have homeopathy. We used to have occupational therapy and speech therapy in our office, and now they're just down the street. So we really try to get all of these biomedical, natural, integrative, whatever word you want to use, tools under our house. And it's not one-stop shopping, but we're trying to get there. And we're trying to really help families in every way possible because, all these kids are so different. And all of these kids do respond to so many different things that if one doesn't work, then something else will. So we try to get a team approach in our office. And a couple years ago, because most of what we use for therapies are natural supplements, I couldn't find exactly what I wanted in the industry that was high enough quality and effective. So 2 years ago, we made our own. So we launched our brand Spectrum Awakening. And, over the past couple years, it started to grow. And we're really trying to create unique supplements to help these kids to support their normal development. So we improve their language, we improve their sensory function, we improve their behavior, we improve their sleep, we improve their digestion. Anything that the body is trying to heal, if we can give it the tools to do it, then it will. The body will heal.
Absolutely. And, today we're talking about, something that many of us in the autism community have heard about, but for those that are new, they might not have, and that's mitochondrial dysfunction. And, why do we need to worry about mitochondria in autism?
Yeah, so I want to take everybody back. Let's rewind the clock to high school biology.
Oh, really? I'm just kidding.
That was only 5-10 years ago, right?
Yeah, okay.
But we all learned that the mitochondria are the powerhouse of the cell. Everybody always spouts that out. And, when we look at our kids on the spectrum, we normally don't think, oh, here's a kid or here's a person that doesn't have enough energy. But this is what's happening inside the brain. So inside the neurons of the brain and the neurons of the entire body, the mitochondria are not producing enough energy. And just before I got on the recording with you, I went to PubMed and I typed in autism and mitochondrial dysfunction. And almost 175 research studies came up. So, we're learning and we're learning and we're learning more. But it's one of the things that a lot of biomedical people are missing. And a lot of kids and a lot of families are missing this as part of their diagnostics and part of their treatment because it's confusing. And the newest study that came out in February of this year talks about the ketogenic diet and how that helps with mitochondrial function. So there's so much out there for us to learn, and there's so much dysfunction of these energy producers that are involved in not just the physiology of autism, but the etiology of autism. And this is a direction that everybody needs to add to their treatment program. Again, autism is so multifactorial and so many different parts of the body are affected, but this has to be the one of those that you include for everybody.
Absolutely. And, for those of us that, don't really know, clearly if you're in the autism world and you're in biomedical, you definitely have heard mitochondria or mitochondrial dysfunction. But for those of us that, before autism, we probably didn't, I don't remember ever hearing that word before. I'm sure I did, but I don't remember it because it didn't have any reference, nothing related to me on that, at the time. What are the symptoms of mitochondrial dysfunction?
Well, and again, like you said, few people have heard of it. And few people have heard of it because severe cases of mitochondrial dysfunction or mitochondrial disease are really rare. So it's not out there in the limelight. So it doesn't get much attention. And when it doesn't get much attention, you don't have enough doctors who are looking for it. So there's only a handful of mitochondrial specialists across the country or across the world, and they really deal with the more severe cases. In fact, I was on that Animal Planet show, Dogs 101, years ago with one of our patients who had severe mitochondrial disease, and then we were able to recover with her animals. That's how we were on. They raised dogs, and the dogs were incremental and implemental in her healing. But mild mitochondrial dysfunction is so confusing, it gets overlooked. So let me start to list some of the symptoms of mitochondrial dysfunction, which are throughout the entire body, and see if it rings any bells for anybody who's listening. The first area that it affects is the gastrointestinal system. And think about this. Think about, again, the mitochondria are producing energy, and if that part of the body doesn't have enough energy, what can it not do? So when we look at the GI system, if it doesn't have enough energy, it's not going to have effective peristalsis. And peristalsis is that movement of the food from our mouth all the way down to the toilet, okay? So if the food's going to sit there, and it's eventually obviously going to become stool, the stool sits there. So the first thing they get is constipation. And how many of our kids are on Miralax and just have this stubborn constipation that doesn't move with Miralax, with magnesium, with mineral oil, you name it? Another symptom, when the food sits there, it ferments. And when it ferments, it gets gassy. Okay? How many of our kids have these big, bloated, gaseous bellies? They're always burping. They're always farting. And that gas is going to cause pain. So now they have abdominal pain. Maybe it gets diagnosed as IBS. Maybe it doesn't. And you add the constipation on top of that. So that's the GI system. The next part of the body that it affects is the neurons and the brain. Headaches are another symptom, and I think a lot of our kids who are head bangers, they may have head pain and that they're trying to knock out. Tinnitus, or some people call it tinnitus, or ringing in the ears. How can these kids explain that symptom to us if they don't have good expressive language? It's also going to cause pain. pain in the extremities. For some people, when it's severe, it's called CRIPS, or complex regional pain syndrome. So those are just some of the neurological symptoms. Add on to that anxiety, depression, for some kids, fibromyalgia and pain that go along with that CRIPS. And other people, when it's more severe, will get something known as POTS, which is postural orthostatic tachycardia syndrome, which basically means you stand up and you get dizzy for a long time. I mean, we all stand up, we all get a little bit dizzy, and then it resolves. But some people stand up, and it takes a little bit of time for them to get their bearings and then, start to walk. So you look at all these symptoms, and they're all over the body. And with our conventional medicine being specialists, one person's a cardiologist, one person's a gastroenterologist, nobody's going to put all these together. But if any of those symptoms, if you or your child have 3 or 4 or more of those, you've got to start thinking, hey, my mitochondria aren't working as they should be.
And I think that's great to be able to listen to the symptoms, because many of us would just be like, we don't know what we're looking at,
Yeah.
Now, how is regressive autism associated with mitochondrial dysfunction?
Okay, so I want to, separate autism into a couple groups. Some kids just don't develop, and this is normally when we have some, odd genetic mutation that the child is born with that doesn't let them develop. But a large portion of our kids have regressive autism. And regressive autism is when you're developing normally, you're learning, you're talking, you're making eye contact, you're babbling, and then bam, you stop and you regress, and the language goes away, and maybe you get the diarrhea, and maybe you get the fever, and all of a sudden that child is stolen from you, okay? And it takes so long for us to get it back. That's regressive autism. The more research that's being done in these kids with regressive autism shows 3 different things. And this is where things start to get controversial, but these things need to be said. Certain kids with genetic mutations in their mitochondria are susceptible to vaccine injury. Okay, now vaccine injury happens. Everybody can Google Hannah Pauling, and one of the first cases in the vaccine court that was rewarded, family was rewarded $1 million because vaccines caused autism in their child. But if you take this genetic mutation, somebody's susceptible, and then you add on a vaccine, usually when the child has a cold, and then you give that child Tylenol, all of a sudden you've got this triad that causes vaccine injury and regressive autism. And how the Tylenol, hey, most people are like, oh, it's just Tylenol. But Tylenol is not as benign as you may think. Tylenol is going to, in addition to reducing fever, it's going to take all the glutathione out of the body. Okay? It's going to take the most powerful antioxidant, the most powerful protector in the body and in the brain, and it's going to take it away for a period of time, okay? And so if you've got this little kid who has an immune system that's all ramped up, and you give them a vaccine that activates the immune system even more, that's its job, vaccines prevent illness, and you take away the defense system of the brain, that immune system can go rampant and start to attack the brain. And this is where we have all of these neurological symptoms that happen all at once because our defenses are down. And so it's this triad of things, the genetic mutations, the Tylenol, the immune system ramped up by the shots, and then bam, it all happens all at once.
And it's interesting because, as you're mentioning the Tylenol and the doctors and pediatricians, you're right, that's what they tell us to give, as soon as we get home after vaccinations. And even, I remember them telling me to give it to him right before we came in for vaccinations, so that way it would be in a system to help him.
Yeah, and I want everybody who's listening, because these are the questions that I ask in my practice. These are the questions that I ask my parents. When I asked them if they thought there was vaccine injury, some say yes and some say no. Okay? And these are kids diagnosed with autism, and, it makes me question, as a physician, well, are vaccines related? Because some of my parents are saying yes and some are saying no. But then when I ask the question, if you think there was vaccine injury, did you give Tylenol at the time? Every single one has said yes.
Really?
There has not been an exception. And I want everybody who's listening, maybe you think your child had vaccine injury, maybe you don't. Was Tylenol involved? And if it was, obviously there's so much we need to do to help improve these kids and bring them back to where they were. But if we're going to stop this epidemic in its tracks, I think it needs to start with not using Tylenol. I think that's such a simple thing that parents can do. Switch to ibuprofen.
Yeah,
Period.
That's the only
just one single thing.
Anytime our son needs anything like that, basically we only use the Motrin for that. So I totally agree with that. So the next question is, how can you test for mitochondrial dysfunction? Like, is there a test for that for the kids?
Right. So, let's say you've got your child here, and some of those symptoms that I brought up, you're like, you know what? I think I want to look into this. There's two basic things you can do. First off, an organic acid test, what they call an OAT test, organic acid test. That's a good analysis because that'll start to look at some of the biomarkers of the cell, and some of them that the mitochondria will use, the Krebs cycle markers, et cetera, and get a good quality organic acid test because even your local lab will do an organic acid test, but they won't look at all of them. And the reference ranges are really important. You want a lab that's going to have the correct reference ranges that we can really use to create a good treatment. But in addition to the organic acid test, which a lot of people have had, most importantly is a thorough genetic analysis, a genetic test of mitochondrial genes, because there's so many genes out there. We've got 20,000 genes. But you've got to make sure you're looking at the genetics of mitochondria.
Yeah, definitely. And make sure that you have a doctor that knows what they're looking at, right?
Completely. Genetics is so complicated. I mean, I really got into genetic analysis a couple of years ago. And 2 years ago, I was a novice. I felt like I was back in grade school. I didn't understand a thing they were saying. But now it's been a couple of years, and we've tested, I'd say 250, 300 kids with thorough genetic analysis and genetic testing. We've learned so much. I've learned so much. I've learned different ways to help these kids. And the goal of any test is to find a treatment. Yeah, and so we're finding new treatments that I would never have thought of with these kids. And that's our end result, solutions.
And how do I know if I find the right testing? That's the thing. I mean, I'm just thinking out loud. So I just recently got for my own self, like I think many listeners have probably heard of the 23andMe, right?
Yes.
And I did that just for myself. I did something similar for my son a long time ago. I want to say a long time ago, like last year, but it wasn't 23andMe. It was like that, and I forgot what it was called, but it was supposed to go over all the stuff, and I didn't know what it really meant. But I was curious. On 23andMe, you could do your ancestry, and then you could do a little genetic testing to potentially see if you have, to be worried about something. My thing for our kiddos, though, because there's so much being now talked about with genetic testing, how do we know what the right testing is, and how do we know where to find it? Right.
Well, you've got to go see either a geneticist or a biomedical doc that specializes in genetics, because, you bring up a good point. 23andMe is so popular. And I did my 23andMe, I'd say 3-4 years ago, when they were really gaining popularity. And they gained so much popularity, the FDA shut them down for a little bit because they were not only doing this genetic testing, but they were giving medical advice. And the FDA said, you know what, you're not a doctor. You're a lab. So 23andMe has kind of shifted from giving medical advice to being something fun. You get to look at your ancestry and, can I smell asparagus in my pee and how much caveman am I? And all the, can I roll my tongue in a U? These are all the cool genetic things that are kind of fun to talk about. And you can download the raw data from 23andMe, and there's many websites now that are processing the data from 23andMe, but it's still very basic. Okay, you can get analysis like your MTHFR SNPs, your COMT, COMT SNPs, your MAO SNPs, your CBS SNPs. All this methylation stuff is very, very popular. And 23andMe will get you that, but it really is not a good look at mitochondria. And other parents, I'll talk to them about genetic testing. I'll say, hey, have you gotten genetic testing? They'll say, yeah, we did it. But I say, well, you need to know what was tested. Okay, you need the reports because the first thing that most docs do is a Fragile X test. Okay, great. Fragile X is so rare. I've met one child and 2 moms with Fragile X, and all the people I've seen in 15 years. Okay.
How many kids with Fragile X?
In my clinic, 1.
1. Okay, it's not very common, right?
No. But years ago, I mean, you again, rewind the clock 30, 40 years, autism and Fragile X were as common as one another. And so back then, way back in the 20th century, in the 70s and 80s, Fragile X was one of the big causes of autism, and that's why it was tested for. But medicine is such an elephant. It takes so long. It takes decades to change. And now, 40 years later, the doctors are like, well, we're supposed to test for Fragile X. That's what the books say. And so you're still doing it. You're still looking for this amazingly rare disease. And people will say, oh, I've had the genetic testing. But no. You have 20,000 genes. You just looked at one. You looked at Fragile X. And good, you don't have it. That's great. The next thing that people get is something called a CMA, or a chromosomal microarray. And that looks for deletions or duplications within your DNA. Imagine you're copying a cookbook and your recipe, and all of a sudden, it says 2 eggs, and the 2 eggs didn't come in the copy. So all of a sudden, you don't have the 2 eggs in your recipe. Or maybe the copy machine put 2 eggs twice, and you're like, 2 eggs, 2 eggs. Oh, I got to put 4 eggs in here. These are called deletions and duplications. Those are also rare. Okay? What we really need to do is get a full exome sequence. So exome is spelled E-X-O-M-E. You need an exome sequence looking at mutations of the mitochondrial DNA. And so the test that we run, and there's a couple good companies out there, the test that we run look at about 2,000 different genes of our 20,000. They're looking at the genes in the mitochondria. They're looking at the genes of the brain. They're looking at the genes of seizures. All 2,000 of these is full, thorough genetic testing. That needs to be done for everybody. So if you think you've had genetic testing done, get a copy of it. Find out what you've had. And, talk to a specialist. Make sure you've got everything done correctly. And again, it's also the interpretation. You may have the data, but, did somebody interpret it correctly? And, every year there's more info. And so you may have a gene mutation that 5 years ago you couldn't do anything about, but now you can.
Yeah.
So you've got to have this info and get a second opinion. Never hurts to get a second opinion.
Never. Sometimes, and I don't necessarily believe it's the doctor not trying to look for everything, but sometimes another pair of eyes just maybe, you find an answer that the other person missed. And I think a lot of times we don't do that,
It's true. There's so much information out there. I mean, there's more information than any one person can know. And everybody has a different specialty and, has been doing something for a long time. And so why not get another opinion? It never hurts to get another opinion because not one person can't know it all.
Now, you talked a little bit about, with Fragile X, right? Well, that's one gene.
Right.
What other mitochondrial genetic mutations, though, would be common in autism? And I remember when I first, I remember with Jackson, I was, I miscarried 3 times before I got pregnant with Jax. And I remember them doing, quote unquote, what we thought was genetic testing. So when you said that, I was like, yeah, I thought I had that done too, right? And I remember them testing for Fragile X because they said that was the closest thing that at that time, and he'll be 15 next week, but they said that was the closest thing they could test for to be in the family, quote unquote, of autism, right? It was like on the farthest spectrum is what they told me. And because I had asked, because I remember asking about autism, I was nervous about autism even 15 years ago because I'd met a family with autism and I just got scared, right? And they said, you don't have Fragile X gene and neither does your husband. So, are there, mutations that we should be looking for or that are common that we know about today?
There are. And again, you've got thousands of genes that could be, predispose you to autism. There is no one autism gene. Okay, autism is not a genetic condition that you.
It's not like Down syndrome where you can definitely see the genes. Yeah.
Exactly. But there are many that will put you at risk. And that's why when you have, when you are a family with one child with autism, you have a higher risk of having another child with autism versus a family without a child with autism because there's predisposing factors. So there's predisposing genetics. And there's some really interesting ones that I've seen. So just to name a few from our clinic, there are many genes that affect CoQ10 production. And so many of us are familiar with CoQ10. It's a supplement for energy because it's CoQ10 is used by the mitochondria to create ATP and create energy. And many mutations in the body's own ability to produce CoQ10 can be affected. And so we see those, if we see any mutations in those CoQ10 genes or the CoQ genes, then we're going to give these kids CoQ10. And they respond really well to that. We have a huge number of kids. This is one of my favorite genes. Remember you've seen those Snickers commercials that people get hangry. They get angry when they get hungry, right?
Yep. So
there is a hangry gene, and it's called ACADS, and it has to do with how the body turns fat into sugar. Because, when you eat food and you eat sugar, you get energy, and then that sugar gets used by the body and used by the cells. And then you run out of sugar, so the body will then take fat and turn the fat into a sugar molecule so you can maintain your energy throughout the day if you don't eat anymore. And some people have a problem turning their fat into sugar and metabolizing all that fat. So that's why 2-3 hours after they eat, their sugar's gone out of their system, and they start to get really angry because they get hypoglycemic because they can't convert the fat into the sugar. Now, it's a really common gene mutation, and really common is about 6 to 7% of the normal population, okay? So 6 to 7% of regular people get hangry, really hangry. But in our office, 80 to 90% of the kids on the spectrum have this hangry gene. And so these kids they need a snack. And you're going to have an emotional basket case, and you're going to have to walk on eggshells if you don't feed them regularly. So that's another cool one that we see.
And can you help with that, though? Like, you basically can help by feeding them, right? But is there anything else you can do to make to keep it more regulated?
For that one, unfortunately, no. But it's just knowing that you have to feed these kids regularly. And most of the time when I tell this to parents, they're like, oh, yeah, I know. I know I have to feed them regularly. But it's confirmation that you're not making it up. This is a real medical thing. So you just have these things ready. Another one that we see a lot of is a gene called LRRK2, LRRK2. It's actually a mitochondrial gene that predisposes you to Parkinson's. And a lot of our kids who have tics or maybe even diagnosed with Tourette's have this gene mutation. And you think about Parkinson's, you think about these older people who are all constantly shaking. It's very similar to a kid with tics or a kid with Tourette's.
And what can you do for that?
That one, we use a couple things. We use a lot of high-dose antioxidants, and I like to use a lot of phenylalanine. Now, phenylalanine, and again, like I mentioned before, one of the things I specialize in is balancing brain chemistry. And phenylalanine is a protein, or let me rewind. All the chemicals in our brain, the serotonin, the adrenaline, the dopamine, the norepinephrine, they're all made of protein. Okay, and they're made of different proteins. So the phenylalanine is the protein that's the precursor for dopamine in the brain. And so if you want to increase dopamine in the brain, you give somebody phenylalanine. And so when we just remember that movie, what was it called? It was with Robert De Niro and Robin Williams, Awakenings. That was it. Mm-hmm. They were in the hospital with all the Parkinson's people. And it was a movie about the discovery of L-Dopa, the drug that helped all the people with Parkinson's. And L-Dopa is one of the precursors to dopamine. So we're able to give this phenylalanine protein and upregulate the dopamine, and then the tics start to go away.
Wow.
So it's pretty cool.
I love the fact that, I feel like when parents are listening right now, what's coming to my mind is that, we're still learning so much. I mean, even from when my son was diagnosed, 13 years ago almost? Yeah. What we know today from 13 years ago is just, I feel incredible. And I just believe that there's so much hope. There really is just a lot of hope because we're continuing to get doctors like you,
That's what everybody needs to learn. And, I see not very few things depress me, but when I hear naysayers, when I hear pediatricians say, you got nothing, put them in a home, they're done, that is depressing. Never take away a parent's hope. Never take away the ability of somebody who's been doing this and working at it for so long to help your child recover. And some of our kids recover, some of them don't. But like you said, we're still learning, we're still trying, even from a perspective of science. There was a research study that came out last week, or a week before we recorded this, that we just learned where platelets are made. We always thought platelets were made in the bone. We just learned they're made in the lungs. In the 21st century, how are we learning new basic medical things?
I'm glad we are, though, and I like that you're a doctor that doesn't say, I know it all and I'm going to keep learning more. Not to say, all doctors do this, but there are definitely some doctors I've met that will basically say, this is how it is and it's black and white, and just like those doctors that say put your child in a home, right? Yeah. And don't ever want to explore. And I feel like, and I'm not a doctor, clearly, but I feel like if I were to be a doctor and that was the chosen profession, I would never want to stop learning, because it's called a practice, because how I believe is that you're constantly trying to practice to get better and better in medicine, because the technology continues to get better and better. And, what we learn in the science gets better and better. So it seems to me if you're with a doctor that doesn't ever grow their own mind, that would be not the doctor I'd want to be with.
You're right. Yeah, you're right. And it is. And, so many doctors are overwhelmed now with just the vast amount of numbers of people. And you go into your office and you got to see 30, 40 people, and that's one every 15 minutes. The patients don't like that. The doctors don't like that. But that's how the system has been, created by the insurance industry. And you can't learn from your patients that way. You're just doing the same thing. You're writing the same scripts. And the only way that most doctors learn is from their pharmaceutical reps. Pharmaceutical rep comes in and says, hey, here's the new thing, use it. And they're like, okay, I got to go back to seeing a zillion people every 10 minutes.
Wow.
And so it's I don't blame the doctors, because they most people, go into the medical field because they want to help people, but then they get pushed into this system, this wheel that doesn't allow them the time to learn. And that's something that we've chosen in our clinic, in our practice, to take the time and to watch. And, it's not knowledge anymore. Anybody can go on the internet and have knowledge. It's about experience. It's about, whatever you do, doing it day after day after day after day for years. How many kids have we seen in and out of our doors over 15 years? That experience is what, we have to offer, more than the knowledge, because anybody can Google anything and see the knowledge out there.
Absolutely. And now you mentioned a little bit about supplements, but, and I think that's good to be knowledgeable in, because there's so many supplements out there, and I even get overwhelmed in that. What improvements in kids do you notice with mitochondrial supplements? And, obviously, do we recommend certain ones? I know it's not a one-size-fits-all kind of thing, but right. I'm sure there's a kind of overall thing to be looking at.
Well, I'll tell you that, let me divide this up into the common ones and then the brand new one that I am super excited about. The common ones are things that help the mitochondria function better. CoQ10, like I mentioned, is a great one. B vitamins are another great one, especially B1, B2, B3, the thiamine, the riboflavin, the niacin. Those are kind of the mitochondrial B vitamins. I know everybody's excited about the methyl B12 shots and methylfolate. You were talking about your 23andMe, so, we need to talk about your MTHFR mutation, because not only is that associated with methylfolate supplementation, but it's associated with infertility.
Does that show on the 23andMe, I wonder?
You're going to download, and a lot of people have done 23andMe like myself, and you're going to get your results. You're going to download your raw data from the 23andMe website, and you're going to upload it into another program, and that will kind of give you the breakdown of MTHFR and other methylation SNPs. And cool. We do that for our, I think I was sitting down with you last year at a conference, and we were looking at these methylation SNPs with other families and other mothers. And we do this in our office too. We sit down, you take your 23andMe data, and you run it through a program, and You look at all these things, and people will go on the methyl B12 supplements and the methylfolate supplements, and great things can happen. Your kid can start to talk. But other kids, they get worse. I mean, how many people have methyl B12, let me use it, and then their kid just goes crazy. There's so many genes involved that you have to bring balance to them all.
And so when you're looking at the supplements for mitochondrial, which ones would you break down to kind of look at then? I know there's so many different ones.
Again, I like the CoQ10. The B vitamins, you can get a B vitamin that isn't methylated, just a regular one. Carnitine is another one that's popular. But I'll tell you, the thing that I'm most excited about, and this is the new supplement that we have in develop for our supplement line, Spectrum Awakening, is a supplement of ATP. And I want to know if you've tried it with Jackson, because the end goal of all mitochondria is to produce ATP. ATP is molecular energy. And if the mitochondria are not functioning well because of genetics or what have you, then they're going to be producing less energy. And so we started giving ATP to our plateau kids. And I define plateau kids of, kids that I've seen for years, and we've made improvements, and their language is better, and their behavior is better, but you can still tell that they have autism. It's mild, they're high functioning, but you're not there at complete remission. And we started giving these kids ATP.
And are you saying like ATP, like Apple T, like Tom P, like Paul, ATP?
Yes, exactly.
Okay.
We started giving these kids this as a supplement, and their language is improving, their conversation, not just their words, but their conversations, that interaction. I mean, that's what we crave. We're looking for that interaction with our child as a regular interaction we have with other neurotypical people. And that is what's improving. And again, this is brand new for our office. It's just the past couple of weeks, but we're adding this to our product line soon. And I think it's going to be the next step in our clinic over the next year or two.
Is it a liquid or a capsule or a powder?
Well, we're currently searching around for producers. And most of the stuff that we have, we try to get as a powder. And we try to get it as a powder because, you can mix powders into foods and drinks. Usually when you get a supplement that's a liquid, they've got other additives in there to make the liquid homogeneous. In our products, we try to keep as clean as possible, because kids are reacting to so many different things. So powders for us are best.
And what you mentioned for a child plateau, when I think of plateau, I think of a resting place. And, then we kind of have to focus on what we do next, right? And I think listeners with parents, children with autism, we've all hit a plateau at some point where we have to then continue to see, where do we go from here? When you talked about ATP, this new product, you were talking about kids that might be higher functioning and, but still have, kind of some symptoms of autism. What about kiddos that have progressed, definitely have autism, might be more, and it's hard for me to say mild to moderate or moderate, whatever that means today, right? Because everybody has a different definition, I think, of that. But, children that are definitely delayed and need more help, would they work for those, I guess you can't claim it works for any child, but could a parent of a child like that be able to use this supplement as well, or potentially look into it?
I think they should. And again, everything doesn't work for everybody. And that's why it's the spectrum. There's so many different things. Even what we do, some of our kids, we balance brain chemistry and that works. Other kids, we balance their hormones and that works. Other kids, the diet's amazing. Other kids, hyperbaric oxygen just wakes them up. So everybody's responding to something different. But I'm really, again, this is new for our clinic. We've just been using it for a few weeks. But I think the potential is so huge for every child to use ATP to help their mitochondria support their entire body. And again, let's go back to those symptoms. I was listing symptoms of the brain, of mood, of migraines, of development, of sensory function, of all the GI issues, the gas, the bloating, the digestion, the peristalsis, the stomach pain, the constipation. What if the mitochondria, we're giving the mitochondria the energy it needs to make all those things function? Imagine what could potentially happen. I think everybody would benefit by trying it. And again, nothing helps everybody, and anybody who tells you that's lying. But to try that for everybody, I think it's going to be huge. I mean, we'll find out. We have to give it a year, but I think it's going to be a turning point for us.
Is it a high cost?
Well, we always try and keep our supplements at a reasonable price, and it also depends on dose. Like the first supplement we found, and we don't have it in our line yet, but hopefully we'll be having it soon. The first supplement we found was about $20 or $30, but it was low dose, and so now we're finding higher dose things. But it might start to range between $50 to $70 a month. But one of the things that we use in our supplement line is we give all families free samples, because we want people to try stuff, because everything's not going to work for everybody. And how much money have people wasted by buying all these things and they're sitting in your closet? And I feel horrible when people leave our office with something and they take it home and their child doesn't like the taste of it. And they're like, oh, we just, you wasted all that money on something your kid's not even using. So we send out
We've all done that.
We've all done that.
Yeah.
And I'm sure your closet, my closet, it's full of supplements that aren't used. So we send samples out to every family so they can try everything and see if their child will handle the flavor of it. Because with all the sensory issues and all the taste issues, that's the biggest thing. So we want to put stuff into everybody's hand. And anybody listening can go to our website, spectrumawakening.com, get a free sample. We'll mail them out to you.
Is it U.S. only? I'm assuming, just because we have a lot of international that might be listening as well.
Oh, good. That's a great comment. The samples are U.S. only. But we now ship products internationally to Canada, England, Australia, and Singapore.
Okay, so that's good to know.
And obviously, our big hurdle is customs. We want to get this everywhere. Anybody who wants it, we want them to have it. So the customs hurdles is really our big issue. I'm amazed you can get into Canada. That's good. Yeah, and other people, because our office will do a lot of Skype appointments with people around the world. They'll often have relatives in the U.S., and so we'll ship it to their relatives, and the relatives will pack it up and hide it in some gift bag and send it out to them.
And isn't it crazy? And it's a supplement. Like, that's what I find to be the craziest part of the whole thing. Although you could ship them, cases and cases of, horrible cookies filled with anything you wanted, and tons and tons of Coca-Cola or beverages. That would totally hurt them. But you can't give them, goodness, if you give them a supplement that might help their autoimmune issues.
Yeah, exactly.
It's crazy. So now, how does mitochondrial treatments fit into the big picture of biomedical treatments?
Well, it's part of the whole, and as we talked about in the beginning, it needs to be the part of everybody's treatment, because everybody should be looking at their diet. We all know that. We've got to clean up our diet. One of our new products, actually, not to get off the track, one of our new products is an egg-based colostrum that reduces food sensitivity inflammation, which is pretty cool. But you've got to do diet. You've got to work on your digestion. You've got to make sure that you don't have any candida or leaky gut or, what type of intestinal inflammation. You've got to make sure your poop's moving. You've got to make sure you have good nutrition. You've got to make sure that you are doing your organic acid test and your amino acid test. You have to make sure your brain chemistry is balanced. You've got to make sure you've got all the external therapies, your OT, your speech, your ABA. There's so many different parts of the wheel. And mitochondria is a big one because it affects so many things. If your mitochondria is affecting your digestion, then you've got to help. You want to help your gut. How many people have been using nystatin for over a year and they're still using it because nothing's happening? You've got to support the every cell of the body with the energy that it needs to do what it needs to do. You want your brain to develop, you need that energy. I can balance, like I said, I can balance dopamine levels with phenylalanine. I can increase your melatonin or your serotonin with tryptophan. But those neurons need to make connections. We've got this neuroplasticity, and nerves need to move. That requires energy. And so if the body needs energy to do its daily job, mitochondria, in treating mild mitochondrial dysfunction of autism isn't just part of the puzzle. I think it's a major integral part of the puzzle.
What's interesting is that, a lot of the speakers that are part of the summit, a good portion of them at some point brought up the word mitochondrial or mitochondria, even if it wasn't part of their talk, right? And
right.
So, and I've been interviewing for a long time now, different people and different experts, and I feel like more and more I keep hearing, I've been talking a lot today, clearly, mitochondrial and, everything about the gut. And it's funny because, even like 10 years ago, they were kind of talking about it, but it seemed like we were more focused on diet. We were more focused on, the probiotics and the brain-gut connection. But it feels like even if you're not in like a quote-unquote specialist in autism these days, you have some understanding that the mitochondrial dysfunction is really taking place here with our kids. So in some ways, not in some ways, always, I think that's great because I think that's going to force people to learn more, to study more, to find out new ways to help. Would you agree?
Yeah, and this is how we learn as a team and as a family and as a group. Like you said, how many years ago? 10 years ago, it was all about candida. It was all about the gut. And that's still important. But I think we found, over the past 10 years that while that helped, there were limits to it. And so it's a good thing that everybody's continuing to search for more. It's a good thing that I pull up a website and type in autism and mitochondrial dysfunction. I get 175 research studies that have been published on this stuff. And so the more that's out there, the more we learn as a group, and the more that we try different things, and we find things that work and things that don't work, we learn. And, fast forward 10 years from now, what's it going to be? It's not going to be mitochondria anymore. It's going to be something else.
Yeah, absolutely.
And so we're going to keep learning, and we're going to keep learning. And that's, we can never stop trying. Ever.
And now what new treatments are on the horizon for your clinic?
Well, again, I think I mentioned, the big one that I'm excited about is this ATP product that we will be adding soon. We don't have it now. But we're recording this now, and it's almost going to be World Autism Day or World Autism Awareness Day. And we've launched 5 new products to add on to our Spectrum Awakening line. And, we've got some good basic stuff like broccoli sprouts and chewable methylfolate, but I think 2 of the new ones that I want to make sure people know we have. The first one is chewable 5-HTP. Now 5-HTP is very common. It's been around a while, very simple, but I'll tell you, I haven't seen any supplement improve language and speech like 5-HTP. So it's very simple. It's the protein precursor for serotonin and for melatonin. But if you take enough before bed, you may see your child develop some language within a couple weeks, which is great. The other
is it
one,
high doses or recommended doses on the bottle, typically?
Well, recommended doses is what's on our bottle. Usually I'll give like 100 milligrams, depending on the age of the child. And again, it's not for everybody, but if language is a big issue for you, that's a good thing to try. I had a 16-year-old girl who had 0 language, none, and I gave her 5-HTP, and she just started talking like out of nowhere, Wow. And now she's 19 and in college, and she's just a regular kid. The other one, which I briefly mentioned, I think is really cool. I call it an egg-based colostrum product. And a lot of people are familiar with colostrum because it's the antibodies that come in your breast milk that provide amazing immune balance to an infant. And a lot of colostrum products are out there, but they're dairy-based, and a lot of kids can't handle the dairy. We just produced one that's made of egg. And it's not an IgG or an IgM for people who know antibody terms. It's an IgY. So it's a totally different kind of antibody made from eggs. So if you're allergic to eggs, you can't have it. But if you're not allergic to eggs, it's going to help balance the immune reactions in the intestines, reducing food sensitivities. It reduces zonulin levels. Zonulin's kind of a new gut testing term. So if you're doing stool tests, you may test for zonulin. That's kind of a marker for leaky gut and inflammation. And it reduces that by 90%. It reduces histamine in the body. It increases DAO activity to improve allergic responses. It's an awesome way to balance the immune system and your reaction foods. Then we have so many kids are on these diets because they need to be, but then you're eating a different food because you can't have gluten or dairy or whatever, and all of a sudden you become reactive to those foods because the inflammation hasn't stopped. So that's one of our cool new things. We call it belly balance.
And those are the things so 5-HTP, the ATP, the egg-based colostrum, those are the things that you're in your clinic that you're kind of excited about.
Yeah, those are our new things. You're
not the only things. I mean, clearly your clinic is, like we said earlier, not the one-stop shop. But my gosh, I've never seen a clinic that have everything that you guys have. That's so cool.
That's great to hear because I know. I mean, you've been such a benefactor for so many families and helping them learn that there's hope out there. So you've seen a lot and a lot of things out there. And so, we're trying to provide for those kids and those families.
Yeah, anytime you can have it easier for the families to have access to, resources and being able to learn, I mean, I think that's just fabulous. Now, you talked about, I can't believe an hour's almost up. I swear, I feel like when I talk to you, it goes by so fast because I literally have been writing notes down this whole time. So when I pause every now and then, it's because I'm writing down notes as fast as I can.
Well, I hope everybody is.
I'm sure they are. And the difference, though, is they get transcripts, depending on what package they're getting. For most of the people get transcripts. So it's like it's easier for them to highlight stuff. Me, I'm just doing it, so I'm trying to write it down as fast as I can. Right. So my question, you mentioned that you, if somebody wanted, we talked about, you go to your website and they can get free samples. We talked about what countries they were in. Can we go ahead and give that website again?
Yes, so it's spectrumawakening.com. Spectrumawakening.com.
And you're in Connecticut, and people come from everywhere, but you guys can also do Skype calls to answer questions as well, you had said?
Yeah, I'll tell you, thank goodness for technology, because we do Skype calls all over the world, and insurance companies now will pay for this kind of telecommunication visit. And we're an insurance-based clinic. We want to make our services accessible to everybody. So we take most private insurances, and you can even do that for Skype calls.
Wow, I love that. And that because nowadays it seems like it's almost, it doesn't seem like people don't do it. It just seems, I don't want to say impossible, but it just seems that's very hard and very rare to find. So right. We talked about a lot. I feel like we gave a lot of great information, or you gave a lot of great information because I wrote it down. What message do you want to leave parents with today?
Well, I think it's twofold, and it's really the message that you've been preaching for years, which is never stop trying, and that there is hope because we have kids here who are improving, and we have kids who recover. And no, it's not all of them, but boy, do we want it to be all of them. And with so many of us out there, like you and myself, and then all these other people who are on this summit, but this is what we dedicated our lives to. And we want families to try for their child. I mean, you're a parent, I'm a parent. What wouldn't we do for our kids? So yeah. That's really what everybody needs to believe and hear from other families that there is hope. Not from me, not from the docs, from the other mothers, from the other parents, from the other families.
And that the doctors are still learning, but they're not giving up, and they're going to keep on trying for our kiddos, doctors like yourself. And if for some reason you're with a doctor that doesn't believe in your kiddo, oh my gosh, I'd be running so fast the other way. I can't even tell you.
Get another doctor. Never have anyone stifle your hope.
Yeah, you want to find a doctor that believes in your kid 100% and believes in you and listens. So thank you so much for believing in our kids, for listening to our parents, and for just not giving up because we can't do it without you guys.
Well, thanks for helping us spread the message, Kristen.
Absolutely. And thanks all for listening.